My name is Bruce. I've been a competitive powerlifter for many years, and because of that hobby, I've had several injuries and issues throughout my body, and more importantly, specifically my left hip and my right knee, which is why I had to reach out and get a consultation with Azalea, specifically Dr. Andrew Hester. At the time that I was having these problems, I was working at the Panola College in Carthage, Texas, and I just reached out to several people who have had similar orthopedic issues and asked them where they saw treatment. And Azalea was brought up, and I believe I did hear Dr. Hester's name, but then I just did my own research and looked into, who would be a viable person to do my procedures based off of their specialty. So that's how I actually made the first initial contact with Azalea and Dr. Hester. I had my left hip done on March the 8th, 2024. And after that, I knew that I was going to have my right knee done, and that the only way I was going to have that done was with the assistance of Dr. Hester. So July 17th of 2024, he performed surgery on my right knee. And with that said, both have been I'm very pleased with both, but I also know that I'm going to have to come back at some point and get my left knee done, and it will be with Dr. Hester.
Hi, I'm Dr. Andrew Hester. I work with Azalea Orthopedics, and I specialize in hip and knee reconstruction. So from the moment I met Bruce, I knew I was up for a challenge, because the first thing he told me was he deadlifted over 600 pounds. And he came to me with severe degenerative disease of the left hip and the right knee, and we had to come up with a game plan to try to get him back to where he was prior to the severe pain he was experiencing. Yeah, so in the office we looked at his x-rays, and he had severe bone-on-bone disease of the left hip and the right knee. And he had already tried taking anti-inflammatories, he had tried steroid injections, and he was still at a point where he was experiencing severe pain. And that was the moment we decided really his only option would be surgical.
On both my left hip surgery and right knee surgery, I did stay the night. And when I got out, we started rehab immediately. And it was an ongoing process. And it did take some time. There was not immediate relief. There was some discomfort. There was some pain. But through the rehab process, I gradually improved and got better. So as far as follow-up meetings with Dr. Hester, both for my left hip and right knee, additional x-rays were done. And Dr. Hester was very pleased with how things were coming along with the rehab, and more importantly, my progress. He felt like I was, as far as timelines, I was doing very well, and he didn't see any issues of concern, no reasons to bring me back for any other type of medical procedure, and just to continue on with the course of rehab for both of those surgeries.
After surgery, he recovered very quick. He, within weeks and within a few months, was deadlifting and sending me videos of it, which was very satisfying to see. What really makes this case unique is Bruce's incredible outcome with how quickly he got back to a very high level of activity after having both a hip and knee replacement done within just a few months.